Hey guys, so it's Sunday, and yesterday I got a call from a colleague who has a friend coming in from Arizona and he needs help. And I wanted to talk about it because his story explains one of the biggest problems in medicine today. People are being sold treatments before anyone really understands what's wrong. Here's the situation. In 2025, he was involved in a serious motor vehicle accident. He injured his shoulder and his neck. Now, this guy is a builder. He works with his hands. He works with his shoulders. He needs his shoulder to function. This isn't recreational golf pain. This affects how he earns a living. He ended up having rotator cuff surgery and then spent 11 months out of work recovering. Think about that for a second. 11 months. But here's the frustrating part. He still hurts. His shoulder still hurts. His neck still hurts. He can't use his shoulder at work, and he can't even sleep during the night without his shoulder waking him up. And despite all of this, nobody ever ordered post-operative MRI of the shoulder. Nobody ordered an MRI of the neck. So before we talk treatment, we have to answer a really important question. Why does he still hurt? Did the rotator cuff heal? Is there scar tissue? Did something partially re-tear? Is the biceps tendon involved? Is there a labrum problem? Is the pain actually coming from the neck? Because, and this is incredibly common, people think they have shoulder pain when the problem is actually in the neck where there's an irritated cervical nerve root or facet joint, especially after a car accident. Now here's where the story gets interesting. He was offered what they call stem cell treatments at a clinic in Arizona, but these weren't his own cells. It was something coming from a vial, not autologous. And there wasn't even a physician evaluating him, just a mid-level provider offering the treatment blindly without ultrasound or x-ray guidance and with no plan for after the procedure for rehab, laser, shockwave, or EMTT. One shot, $5,000, and see you later. Good luck. And to his credit, he paused because he didn't want to jump into something he didn't fully understand. He said to me, I have absolutely no idea where those cells are coming from, so how can I trust them? And you know what? He's absolutely right. He also didn't want steroids, and honestly, I respect that decision because steroids can sometimes calm inflammation temporarily, make things feel better in the short term, but if we still don't know what's causing the pain, where do we even inject them? And let's not forget, if there is still an issue with tissue damage in the shoulder, steroids can make that damage impossible to heal. So he doesn't just want to mask symptoms with steroids. He wants to fix what's going on and get back to where he was before his car accident. So here's my plan. Step one, diagnosis first. We're getting the imaging, MRI of the shoulder, MRI of the neck or the cervical spine. We're going to understand exactly what healed, what didn't, and whether the neck is contributing to his shoulder pain. Then, and only then, we build the treatment plan. When I see him in person, I'll be able to examine him, perform an ultrasound examination in my office, and use the MRI findings to help formulate a comprehensive plan and help him to achieve his goals. If the findings match the exam, we'll likely treat both the shoulder and the neck with PRP. And depending on what the shoulder looks like, we may add bone marrow aspirate concentrate from his own body to support healing. But notice something important. I'm not starting with the treatment, I'm starting with the diagnosis. Because regenerative medicine done right isn't about chasing shiny objects or stem cells in a vial or miracle claims. It's about understanding the problem first and then choosing the right biologic treatment for the right patient. Well, you guys, I'll keep you informed about what his diagnosis is, how we treat him, and how he responds. I hope you have a great day. Enjoy the rest of the weekend.